tell us a little bit about yourself?
Sure. Um, I'm a psilocybin facilitator. I work at Satya. I've been here for about a year and a half, maybe a little over that. Before this life as a psilocybin facilitator, I was an anesthesiologist for 35 years. I worked mostly in Texas, at the University of Texas, and at Texas Tech in Lubbock for most of my time. And I moved to Ashland 5 years ago, and by movements of the universe, I'm sitting in this chair.
Which is really amazing, and I've told you this many times, I'll tell it again. We are so lucky to be able to have you seeing clients here at Satya. It's just an amazing thing for us, so thank you so much.
Well, it's my pleasure, absolutely.
Thank you. So you've seen over 150 people, right?
I have a little bit more than that, but yeah.
And the most of them have great results.
That's true. I would say, off of the top of my head, I think 30 to 40% of people are not the same people who walked into the room as walked out of the room. I think they have life-changing experiences, mostly dealing with depression, anxiety, and PTSD. I do a lot of veterans. Veterans seem to even be better than that percentage.
Yeah.
I mean, they do really well.
Yeah, so this isn't a silver bullet for clients.
For some people, it may be a silver bullet. It's almost, it's amazing. But for a lot of people, it takes a lot of internal work. The psilocybin uncovers things that you need to look at about yourself, and just kind of shows you the door in, and then it's your responsibility to work on that. For some people, it's like it flips a switch, and they're in a different life than they were before. Their reactions are different, their feelings are different, their emotions are different. But for the majority of people, it still takes some work following the journey.
You have a tremendous success rate. How do you pursue the preparation work?
So the clients, are often referred by Satya. Some people find me through my website, which is called Psilocybin Journey Guide. It's probably 2/3 to 1/3, with Satya referring most of them. Clients talk to a number of facilitators, and then they choose who they want. If they choose me, after they do that, I send them a very nosy health information form where I want to know that psilocybin is safe for them to do. That's really what I'm looking at. All the contraindications to psilocybin are on that form in a variety of different forms of questions, so they'll hopefully answer truthfully. I get their medications. Then after they return the form to me, I go through all their medicines, all of the mechanisms of actions of those medicines. I compare it to where psilocybin works and calculate to my best ability what dose they would need for it to be effective.
Do you think this is safe?
Oh, absolutely.
How come?
It's hard to hurt someone with psilocybin. You can. I mean, there's a few things. Lithium, psilocybin don't go well together. They're actually deadly together, so you don't mix them. If people have some heart conditions, maybe some brain conditions, they probably shouldn't do psilocybin. If someone has a history of psychosis, the literature says don't give them psilocybin. I can't really uncover that original research. I've looked for that many times. I know many people who have had psychotic breaks who have done psilocybin and they never had another psychotic break. But we're not allowed to give psilocybin to people who have a history of losing contact with reality at any time in their life.
Right.
If they're pregnant, I won't do them. Some people might. If they're breastfeeding, they have to throw that milk away. Or I won't do them. I don't want the baby to get the psilocybin.
Right.
But otherwise, people take a lot of medicines and sometimes they block psilocybin, but most things it's really, really safe.
You're in a really unique position because you are an anesthesiologist and you understand drugs. And the profound thing here is that you also teach for a local
Right.
psilocybin facilitator training program, right?
Right, they're actually closed for this year, but the 2 years previous, I have been one of their teachers. I teach pharmacology primarily. Also, I get pulled into setting and dosage at times, but
Right.
mostly I'm the pharmacology torturer. I do the torture pharmacology lecture.
So one of the things that we get asked frequently is, I'm taking an SSRI. Can I do this? Do I have to quit the SSRI to come in? What do you think about that?
So I never ask anyone to change their medicines. If they're on too many medicines, say they're on 5 different medicines that are for depression, I may tell them you need to go back to your psychiatrist and get off some of the stuff because we can't get over or under all the medicines you're on. I've done that with 5 different people over the last year and a half. Most of the time, we can work with the medicines. There's a lot of literature that shows clients do not need to have hallucinations to have very beneficial effects. So I'll use Cymbalta as an example. Lots of clients are on Cymbalta. I actually pulled all of my information on medicine recently that clients have taken. And clients on Cymbalta never have visuals. They never have colors. They don't have any hallucinations that I can tell. But every single one of them has improved.
Oh, that's amazing.
Yeah. So that's one that when someone says they're on it, I go, oh, well, you may not see much, but the results are good.
So what you're saying is that hallucinating is not mandatory
No.
for someone to have a change as a result of psilocybin.
No, they actually give psilocybin and then give them medicine to intentionally block the hallucinations and then check their depression, and it gets better with the same frequency.
Yeah, that's from the research. You don't do that.
No, that's research.
Which is amazing. And, it's just so remarkable that you have that kind of background to be able to say what you just said with authority. And at the same time, you also have kind of an interesting perspective with respect to the mushrooms themselves. We really never know what's going on with clients, right?
No, they think they're talking and they don't talk.
Do clients have a bad trip in your sessions?
I don't think there is such a thing personally as a bad trip. I think psilocybin is not unicorns and butterflies. I think it is a deep self-inquiry into things that we have become stuck with, whether it's anger, depression, PTSD, whatever it is. It takes us on an inward dive to look at those things. And so you may revisit your childhood. You may have conversations with people that are no longer alive. Now, are you really talking to them? I don't know. But the conversations seem beneficial, whoever they're with. I think it's a deep dive into self-inquiry as to why we react the way we do, and maybe helps us have a little understanding of what drives our depression or our traumas that we've encountered in our life. So it's a 5 or 6 hour journey that is intensely exhausting, physically and mentally. You explore a lot of areas of your life that you may not have ever looked at. But when you come out of it, you have a better understanding, usually, than you did going in. So bad trip, I don't think exists. Deep inquiry, difficult, exhausting, yes, that exists on a very frequent basis.
Right. And, I've had the great pleasure to be able to work with you with some clients where we have done dual facilitations, and that's a male and female energy. And there have been some real challenging journeys that we've been a part of. How do you see working through the challenges when clients are really struggling or being challenged?
First of all, we never leave clients alone. I did anesthesia for 35 years. I'm used to staring at one person in a dark room for hours at a time. So I sit in the corner and I don't usually take my eyes off of you. So I can tell if you're getting agitated. I might move closer to you, offer you my hand, help you do some breathing exercises to make you calm. I do use natural scents, so I may burn some sage. I may ring some Tibetan singing bowls to kind of change the energy in the room. But mostly I think it's another person being beside you and knowing that they're always there. I do reassure clients I'm always there. I will give them little timestamps during a journey and say, it's 2 hours now. You've been doing this. Remember, you're doing psilocybin if they seem like they're lost. And that seems to help kind of pull people back to understand that they're at Satya on a psilocybin journey. Because sometimes people do forget what's
Yes,
going on. Yeah.
they do forget. And how do you approach dosing strategies?
Uh, so I'm a fairly heavy doser compared to other people, I suppose. I was a pretty heavy anesthesia doser as well. People pay a fair amount of money to come to Satya. I want them to get their money's worth. So I spend quite a lot of time on their medicines and those interactions with psilocybin from the whatever amount of literature is out there, looking at percentages of decrease in efficacy for the medicines. And I just kind of calculate, what do I think they need? The most we can give is 50 milligrams, and so a lot of my clients do take between 35 and 50 milligrams. That's my most common dosing strategy, is 35 plus 15 or 50 milligrams all at once, because most of my clients are on medicines.
Can people take too much, you think?
Well, we cannot give them more than 50, so no. I mean, people take a lot more than 50 milligrams on their
Outside
own.
of here, yeah.
Outside of here and underground or on their own. And again, it goes back to psilocybin is extremely safe. The amount you have to give to get into trouble is way beyond anything that we would give.
And you've seen over 150 people, so you haven't had any issues with people whatsoever, right?
Not any issues that have necessitated calling for 911 or I've had a backup facilitator come in a few times. Usually it's you, I think. But
When would you call a backup facilitator in? What kind of circumstances would lead to that?
it's almost always a young man who is bigger than me and knows it. And I'm like his mother, and he's not going to do what I say. Almost always. So I usually, young males under 40, I usually do with another male facilitator.
Is that a better situation when you have that second person in the room?
It's a lot less stressful. It's easier for two people to handle a complication if there is one. If someone gets really agitated, it's easier, male and female energy in the room. I think it's easier to calm that person down knowing that there's two people in there watching to keep them safe.
One of the things people ask us about frequently is, are you going to guide me through the journey?
The state of Oregon requires that we have a non-directive approach to facilitation. I think they don't want us to become gurus under psilocybin. So if you ask me, Bonnie, is there a God? I'm going to say, I don't know. What do you think? I don't direct in any fashion other than to reassure people they're safe and that I'm present and where they are and what's going on.
So it's completely non-directive, so we never tell people what to do.
No.
Right. And so if someone is agitated or afraid, that's where, you have to come in and kind of enter their mind in a very gentle and non-directive way.
Yes. But it is okay. I mean, it is okay for people to express emotion, to cry, to scream, to roll on the floor. I don't care. My job is to keep them safe in that space.
Right.
It's not to contain their emotion, but to let their emotions flow freely and in that space, to stay safe in that space.
People ask fairly often about, what else can I do to prepare well for my journey?
My best advice is to let go, to realize you don't have control. You cannot control where the journey's going to go. You can try. I've watched clients try. They don't
Right.
usually succeed, or they may succeed, but then the journey's not successful in itself. It doesn't seem to help their depression or whatever if they spend the whole time trying to control the journey. So best advice is to float down the river, let go, let it take you where it wants to go. If you're a meditator, I have people increase their meditation before they come. I believe in gratification journals for people to write what they're thankful for, to get those things in their mind. I have a worksheet I give them on doing coming up with their intention. So their intention is very clear, and they I think for the client, that's really the most important thing, to decide why they're coming. That doesn't mean that's what the journey will be about, but it does prepare them for doing a deep dive into themselves.
And you do psilocybin journeys yourself, right?
I do.
How come?
I do them all for spiritual deepening and to be more self-aware.
Yeah, that's remarkable. And, you know, every facilitator that practices here at Satya does that same
Yeah.
thing. They're all very, very in tune with the mushroom. Can you tell me a little bit about your thoughts about ketamine? A lot of people come and say they've done ketamine, it didn't do me any good.
So I did ketamine studies. I got really interested in depression back in the early 2000s. It actually started with a book called DMT, the Spirit Molecule by Richard Strassman. It just intrigued me. So I started looking at ketamine for depression. I did pregnant women for my profession. Pregnant women get depressed after having children. So I tried to set up a study with pregnant women, but the obstetricians were not interested. So I went to psychiatry and ended up doing a study just with women, using ketamine as part of my standard anesthetic, and doing depression screenings before and after surgery. So I found it was transiently improved a lot of people for depression, but it was transient. There's less than 1% of the time does it flip a switch like psilocybin can do, where it makes a permanent change in someone's depression. I have one client who's managed to take ketamine for 1.5 years and it's still been beneficial. But for most people, after about 6 months, it seems to lose its effectiveness.
Mm-hmm.
It's very good for pulling people back from the edge of suicide. So if someone is really on their last straw and they're thinking of hurting themselves, ketamine is a great option. IV works better than up your nose or other fashions. There's ketamine clinics all over the country. Still relatively expensive, but it will buy people time while they get other services or get to a therapist where they can get some help and maybe end up in Ashland doing psilocybin with us.
Yeah, I always tell people who call in and say ketamine didn't do anything for me. Do you think psilocybin will help? I always tell them I think that we only talk to the people where ketamine doesn't work.
Yeah, I mean, ketamine, it's not a hallucinogenic, it's a dissociative anesthetic. So it makes your brain, people feel like they're up on the ceiling looking down on themselves. So you do hallucinate, but it's not a true hallucinogenic. It works at a different receptor. It's called an NMDA receptor, where psilocybin works at the serotonin receptor, specifically the 5-HT2A receptor. And also a nice article that shows specific section in your brain that psilocybin binds to 1,000 times more with more affinity than antidepressants. And they think that's the reason for the good antidepressant effect without the hallucinations. It's this one like RPK, some receptor in the brain.
Things you'd want to tell people out there that are considering doing psilocybin services about your thoughts about that?
I think psilocybin is probably the most effective thing that's on the market right now, that's legal. MDMA is probably better for PTSD, but it's not legal. There are some studies going on, but it's really difficult to get into studies. So, I mean, personally, I think if you're suffering from depression or anxiety, if you're a veteran and you have PTSD, I personally do veterans really, really cheaply. I will put them in my schedule. If my schedule is booked, they have first priority always for whatever they want. And they have wonderful success rates. That, for whatever reason, I think they're mature individuals who have been traumatized, and that makes a difference. They're ready to face their fears and move forward.
Veterans have a tremendous amount of courage. Part of the journey is that it's a hero's journey.
Yes.
So, you know, that idea of facing yourself and facing your challenges requires the courage. And that's, I think, one of the reasons why you have such success with them. Because, I mean, I've been here many days where you've had very serious situations with people's
Yeah, I mean, veterans are going to other countries to do this. We're in Oregon, in your own country. It's, a pretty easy flight to Medford, Oregon. We're 20 minutes away. You're not in another country. You don't need a passport.
And you're with people that care about you and that really respect and value you too.
Absolutely.
So, and I think everybody who comes here understands that the moment they set foot in the door.
Yeah.
All right, Bonnie, I think that was fantastic.